We are 2 years into this pandemic. Today we broke a record, not a good record. We have more COVID positive patients in our hospitals in Oklahoma than we ever have. We have doctors that are working for weeks on end. We have nurses that are taking extra shifts, respiratory therapists. We have our executives cleaning rooms, opening boxes. Ambulances are still bringing patients, and it's just hard to not really see an end in sight. We want to be hopeful that maybe this peak is starting to slow, that maybe we're getting there in the next couple of weeks, but it's been exhausting to go through it again.
We're currently in our non-COVID ICU, which is also full. That is where we're trying to get patients that don't have COVID into beds. And there's a lot of competition between patients that have COVID and are critically ill and patients who don't have COVID and are critically ill. Where we used to just take care of the non-COVID critically ill patients, we're taking care of two populations that are competing for beds, and it's very difficult to get them all taken care of.
Sometimes there's a wait of people at different hospitals in town that need to be transferred that can be up to 10 to 20 people long. And that doesn't include the patients that are calling 911 that need to access those pre-hospital services. So how do you manage that? How do you manage that when there's just not enough? When we get stressed here in the ER, we might be seeing a total of somewhere between 50 and 60 patients in the entire facility. Now we might see up to 90 patients, and as you can imagine, there's not 90 rooms in this facility. So that means that a lot of patients are in the halls. They may be in the waiting room. They may be in other temporary facilities for us to see patients.
Half to 3/4 of our rooms every day are taken up by patients that are admitted to the hospital that don't have a bed upstairs. So now we're trying to take care of patients in kind of atypical spaces, in chairs or in hallways or other kind of spaces, any place where we can take a history and do an exam and do some testing. We're seeing patients in those. We've been dealing with this for 2 years now, and we've had more caregivers out with this wave, more people missing work. This is obviously much more infectious. We're just seeing a lot more people coming to the emergency department who are worried that they're ill or were contacted someone with COVID.